Be inspired, supported, and empowered. This is the Global Healthy Living Foundation podcast network.
Bipartisan initiatives are extremely important in healthcare because at the end of the day, no physician, patient chart, a hospital admissions record ever asks you about your political platform before you get treatment. And I truly believe that there is a bipartisan opportunity here.
Welcome to Healthcare Matters Podcast, a podcast that pulls back the curtain to help you make sense of complex healthcare economics and policy issues. He's Dr. Robert Popovian in Washington, D.C., a pharmacist, economist, and chief science policy officer at GHLF.
And across the country in Seattle, Washington, he's Connor Mertens, patient advocate and community outreach manager at GHLF.
And the big reason we're here, the big reason you're here, is to learn a little bit more about healthcare and the economics and policy that surround it. Robert's the expert. In fact, he's one of the few people who has studied and published both clinical and policy-related economic analysis.
And you know what? Connor brings it all to the human level as he helps people with chronic disease be more understood by loved ones and elected officials.
Now that you know a little bit about who we are and why we're here, I just really want to dive into this topic with you, Robert. Recently, you wrote about President Biden's bipartisan opportunity to reduce patient costs. That's such a hot button topic and something that does have bipartisan support. President Biden's in a unique position to make real substantive change for patients. And we've heard a lot of calls from both sides of the aisle to enact reform or at least make costs a little more affordable for patients. And so I guess my first question has to be, has he been able to accomplish that so far in this early point in the administration?
That's a great question, Connor. So far, President Biden has just announced what he believes is the real framework of what he thinks should happen with regards to reducing pharmaceutical expenditures in the United States. Unfortunately, most of the stuff that he's proposing does not impact patients' out-of-pocket costs, and that's something that I believe he believes that he will have to do in the next iteration of bringing policies to the marketplace as to how to help patients lower their expenditures and out-of-pocket costs for biopharmaceuticals. Bipartisan initiatives are extremely important in healthcare because at the end of the day, no physician, patient chart, a hospital admissions record ever asks you about your political platform before you get treatment. Therefore, we need bipartisanship in the healthcare arena. And I do believe that President Biden will eventually get to a point that will be able to produce bipartisan efforts to really help patients and their out-of-pocket costs.
It feels like we haven't been making meaningful progress. What's the holdup, Robert? Why is it so hard to get it done?
It's a complex issue. I mean, this is not something that has happened overnight. So let me give you an example for why we are in the situation we are in. Hospital expenditures in 2019 was $1.2 trillion, which is about 3 times more spending than pharmaceuticals in the US marketplace. However, patients' out-of-pocket spending on drugs in 2019 was $54 billion, which was about 50% higher than the out-of-pocket spending for hospital care. This does not make sense because you remember, pharmaceuticals are the one entity in healthcare system that if used appropriately and if patients have appropriate access to, will prevent more expensive interventions such as hospitalizations and ending up in the emergency room or physician's office. We are where we are, but we know we have the leadership and we should have bipartisan leadership to be able to help patients out.
Robert, I feel like there's so few bipartisan success stories that we hear coming out of politics. It's just so elusive now to find an agreement on anything. How can we do it? How can we reach that bipartisan agreement?
I think that's the rhetoric that comes out of the political arms. But if you look at and peel the onion and look inside, there's a lot of commonality between the two political parties of what should be done. Now we just need the political will to make it happen. For example, there's bipartisan support on both sides of the aisle that we do need to cap out-of-pocket costs for Medicare Part D enrollees. Medicare Part D is the only entity within the Medicare system where patients have unlimited financial exposure to cost of care. And there's bipartisan support for that. There's also bipartisan support that patients should directly benefit from all of the concessions that have been gained by the insurers or the pharmacy benefit managers through negotiation with the pharmaceutical industry.
Wait, Robert, who's benefiting at this point from all those concessions?
It's directly going to the insurers and the pharmacy benefit managers. The patients are not benefiting from it. So these companies are negotiating on behalf of the patients, but instead of sending back or sharing the savings with the patient, they instead pocket that as profitability most of the time. And we're not talking about a trivial number here. In 2019, there was over $175 billion, or approximately 40% of the gross domestic biopharmaceutical spend, that was gained by insurers and pharmacy benefit managers, was collected by pharmacy benefit managers and insurers in form of rebates and fees from the biopharmaceutical industry, and zero number goes back to the patient.
Robert, did you say billion with a B?
Yes, billion with a B. And I want to point people to a study that my co-author and I did, Wayne Weingarten from the Pacific Research Institute, that we looked at the issue of what happens if Medicare basically takes the money that has been negotiated on the patient's behalf, and instead of having the insurers and the PBMs pocket the money, go directly to the patient. And we found that based on our modeling, that eliminating the rebate contracting and passing all of the concessions to the Medicare Part D enrollees leads to lower overall healthcare expenditures and patient out-of-pocket costs. The lower part expenditures is because, Connor, what happens when patients can afford their drugs? They stay on their drugs. They're more compliant with their medicines, and they end up having healthier lives and not ending up in the emergency room or hospitalizations, which is significantly higher in expenditures.
Robert, I guess a good question then becomes, where have we seen successful policy change in regards to this? Is there somewhere we can model this after, where we've been able to bring costs down for patients?
We've seen this in the space of biopharmaceuticals when generics, authorized generics, or biosimilars are available. When they're made available to these patients, patients spend less money and they're more compliant with their medicines. Except, again, this is another bipartisan effort that has been going on, is that we need to eliminate possibility of rigging the system where the pharmacy benefit managers and insurers end up covering more expensive brand name drugs because they make more money off of rebates and fees. And instead, they need to promote generics and biosimilar usage and authorized generic usage. This is not happening in the marketplace because the current model benefits the middlemen, these pharmacy benefit managers and insurers, for collecting all of these rebates and fees and pocketing them. And therefore, they really like covering brand name medicines with higher prices and higher rebates and fees instead of lower cost alternatives like generics, authorized generics, or biosimilars.
You know, Robert, it almost sounds like patients are getting issued a coupon, and then whatever savings they get from that coupon just gets bumped back to the manufacturer. Like, I'm going to the grocery store and I get $5 off my laundry detergent, and Tide is the one that's walking away with the $5.
You're right. This is the problem with pharmaceuticals. Unlike any other segment of the healthcare system, whether it's the hospital, the physician, the dentist, the optometrist, when you walk into those offices and demand service as a patient, and you utilize your insurance card, when you have a co-insurance or a deductible, your out-of-pocket cost is based on a negotiated price that has been done on your behalf by the insurance company in that case, except for pharmaceuticals. Pharmaceuticals is the only entity in the marketplace where patients walk into a pharmacy, they utilize their insurance card, and when they have a deductible or co-insurance, their deductible and co-insurance is based on inflated retail prices that PBM, the pharmacy benefit manager, nor the insurer ends up paying for. Therefore, it's just unfair. These concessions have been done on behalf of the patients, and the patient should benefit directly from them.
We've been talking a lot about what can be done legislatively to affect change and lower these costs, but I think it's only a fair question. The lawmakers aren't the only ones on the hook for high prices for patients. How do we hold pharmacy benefit managers and the insurers accountable?
Well, we need to hold everyone accountable, including the biopharmaceutical industry. We need to ensure that if savings are gained through negotiations with the biopharmaceutical industry, that the patients directly benefit from it, and instead they're not pocketed by the insurers or the pharmacy benefit managers, especially on the Medicare side. Regarding biopharmaceutical industry, President Biden, and this is again bipartisan support for this, should encourage new payment models such as payments for outcomes or guarantees that tie medicines to medicine's value. In other words, regarding biopharmaceutical industry, if the drug doesn't work, you don't get paid for it. We need to basically institute those type of policies to hold them accountable as well.
Well, as always, Robert, I really appreciate you taking the time to talk with us and make sense of what doesn't make sense. I was wondering if you could give us the last word. What's one thing that folks should take away from this discussion?
Well, what patients need to do is encourage their policymakers to work together to be able to reduce their out-of-pocket costs. Out-of-pocket costs for pharmaceuticals, on average, is manageable. It's actually decreasing year over year, except a small percentage of patients that are taking the brunt of the problem. And those are the patients that require drugs that probably are not available in generic formulation. And what patients need to do is encourage their legislators to work in a bipartisan manner to make sure when drugs that are brand name drugs and have high rebates and high fees that have been negotiated on their behalf are directly passed back to the patient at the point of sale, instead of being pocketed by the insurers and the pharmacy benefit managers. Look, we need to meaningfully reduce out-of-pocket costs for patients, especially patients who are suffering from this. Not everybody is, but a small number are, and we cannot forget about them, and we cannot leave them behind. So Connor, I have a question for you. What do you think patients should take away from this podcast?
Listen, I think that so many of our issues in the system boil down to transparency. A lot of the things that you've been mentioning are shady practices done behind closed doors. And I think we have to answer the question, who's benefiting from it? Who's losing here? And at the end of the day, unfortunately, patients are losing. We can be doing a heck of a lot more to make sure that patients are cared for. Is that right, Robert?
And I truly believe that there is a bipartisan opportunity here. Patients are waiting, and we need to help them out. They no longer can go on the way things are as currently set up. We hope that you learned something too from this episode. We'd love to hear from you. Please share your ideas about what you think the bipartisan opportunities are to lower out-of-pocket costs for patients. This is an important issue for all of you. And send us an email, and better yet, including a short video or audio clip, and send it to healthcarematters@ghlf.org.
I mean, how short are we talking here, Robert?
Look, don't worry. We have good editors that help us out. And who knows, whatever you share may be included in our listener feedback portion of future episodes.
As always, Robert, thanks for bringing your expertise, your wisdom. It makes my job a lot easier, or a lot harder, depending on who you ask.
And frankly, Connor, without you and reaching out to our patient population, we will be nowhere near resolving some of these issues. So great job.
Well, that's it for us. Thanks for listening to Healthcare Matters Podcast, a podcast that pulls back the curtain to help you make sense of complex healthcare economics and policy issues. He's Robert Popovian.
And he's Connor Mertens. See you guys next time.
Be inspired, supported, and empowered. This is the Global Healthy Living Foundation Podcast Network.